Welcome to the all viewers and well-wishers of the world. The purpose of my lecture is learn the knowledge from the word and return the knowledge to the word. The motto of my life is learn, earn and return. I have learned a lot, earned a lot, now to return a lot to the word. The topic of today is rubella. Rubella, as one can see, it is also called German measles. It is a viral infection, and one can see the rubella rash. These are the rubella rash all over the body, starting from the face by these viruses, and that typical appearance of German measles or rubella. Introduction of the rubella is the other names. The rubella is German measles or 3-day measles. It is a rare illness that causes a spotty rash. The name rubella is from Latin and means little red, described as a separate disease and entity by the German physicians in 1814. So the name was given German measles. Cause is rubella virus, frequently common in many areas. Symptoms are rash, swollen lymph nodes, fever, sore throat, and the feeling of tiredness. Usual onset is 2 weeks after exposure to the virus, and the duration is 3 days, so that is called sometimes 3 days measles. Introduction continued. It spread through the air. Only humans are infected. Insects do not spread this disease. Complications are bleeding problems, testicular swelling, inflammation of the nerves, encephalitis, congenital rubella syndrome, and miscarriage. Diagnostic methods are finding the virus in the blood, throat, or urine, or doing the antibody test. Prevention is rubella vaccine available, and treatment, it usually gets better in about a week, but it can be serious if one can get it when one is pregnant because of the fear of congenital rubella syndrome. Treatment is just supportive care. Now, the history of the rubella is German physician and the chemist Friedrich Hoffmann made first clinical description of rubella in 1740, and it was confirmed by D. Bergen in 1752 and Orlo in 1758. In 1840, George D. Merton suggested it disease distinct from both measles and scarlet fever. All these physicians were because German, so named it common name of German measles. Name rubella is from the Latin word meaning little red. And here are the pioneers, the Friedrich Hoffmann and Sir Norman Gregg. Those contributions led to the discovery of the disease rubella and the virus. Now, history continued. In 1940, Australian ophthalmologist Norman Gregg found congenital cataract in the infants. He described congenital rubella syndrome (CRS). In 1967, molecular structure of the rubella was observed under electron microscopy, and in 1969, a live attenuated virus vaccine was licensed. In 1970, a triple vaccine containing attenuated measles, mumps, and rubella (MMR) viruses was introduced. Rubella is the third disease eliminated from the developed countries and from most of the countries with vaccination after smallpox and polio. Now, epidemiology. Rubella occurs worldwide. peak during spring in temperate climate before the vaccine was available against rubella. In 1969, widespread outbreaks occurred in the United States and Europe, affecting children 5 to 9 years old. Since introduction of the vaccine, disease is now rare. Cause of the rubella is rubella virus in genus Rubivirus, family Togoviridae. It is an enveloped virus with single-stranded RNA genome, single genotype. It is a spherical in shape, 40 to 80 nanometer in size, positive sense single-stranded RNA virus with spike-like heme containing surface projections and electron-dense 30 to 35 nanometer core is surrounded by a lipoprotein enveloped because it is enveloped virus, highly sensitive to heat, extremes of pH and ultraviolet light. At 4-degree temperature centigrade, virus is stable for 24 hours. So here one can see the virus structure. It is outer lipid bilayer membrane. Then it is reverse transcriptase enzyme which is present in the center of the virus. And here it is the viral genome, RNA, single-stranded virus genome one can see. And here there is a nucleocapsid and the glycoproteins and the projections like agglutinin and the others. These are all the spikes rising from the envelope of the. So according to the greatest brain of the world, the only source of the knowledge is experience, said by Albert Einstein, because there is no substitution of experience. If you are 5-year experience, it means you have spent 365 to have 1 year experience and then multiply that. So there is no substitution of experience. Now, spread of the rubella spread from one person to next through air via cough of the infected people, respiratory route via sneezing and talking loudly. People are infectious a week before and after appearance of the rash. Babies with the congenital rubella syndrome spread virus for more than a year. Once recovered, people are immune to future infections, mostly test available to verify the immunity of a person by the antibodies in his or her blood. So here one can see the cough, sneezing and talking that spread the virus from this infected person to the non-infected person. Similarly, this infected person also spreading via the respiratory route to the other susceptible person. Now, pathogenesis. Virus infects cells in the upper respiratory tract. During this incubation period, patient is contagious, can spread the virus to the others. Virus replicates in the nasopharynx and the regional lymph nodes. Virus enter into the blood 5 to 7 days after infection and spread throughout the body. The virus has teratogenic properties and crosses the placenta and infect the fetus, causing the congenital rubella syndrome. Virus can be found in the skin, blood, and respiratory tract of the infected person. It infects the joints, causing arthritis, and placentitis, causing the fetal damage. So here one can see the virus through its spikes attached to the host cell, and then it get enter and fuses into the cytoplasm of the infected cell, and here there is the nucleus of the host cell, and this virus genome merge with the genetic material of the host cell nucleus, and now it is going to give order to the ribosomes and the Golgi complex to make the new virion particles, and these new virion particles get out through the cell membrane of the host, taking the cell membrane as the envelope, and the new virus is formed, which is having the spikes and all the complete thing like this, and again capable of infecting the new host cell. So here one can have the idea number one, the entry of the virus, and then it is going to spread through the blood. It is going to reach to the different organ, and it causes the disease like lymphadenopathy and rash and fetal abnormalities when it infects the fetus and causing the cataract, heart problem, uh, ductus arteriosus, and the deafness. So the entry of the virus here and the exit of the virus is also from the respiratory passage and getting to the blood and reaching to the different organs of the body, causing the infection. Even the fetus is involved. Now, signs and symptoms of the rubella disease is mild. 50% people do not feel anything. A low-grade fever, about 100.4 degree Fahrenheit, sore throat and the fatigue. Rubella has symptoms similar to those of ordinary flu. Swollen glands, suboccipital and posterior cervical lymphadenopathy is seen. The swollen gland persists for 1 week. Joint pains, headache, and conjunctivitis is seen. Adult women are particularly prone to arthritis and the joint pains. Rubella can affect anyone at any age. The main symptoms of the rubella is a classical spotty rash, starts behind the ear and then comes to the face and ultimately then spreads to the neck and the whole body. Here one can see behind the ear, the rashes are there behind the ear, then it comes on the face, and from the face it do spread to the whole of the body. Now, the rash looks red or pink on the white skin. It can be harder to see on the brown or black skin, but might feel rough or bumpy if you touch it with your hand. Rash start 2 weeks after exposure and fades or lasts for 3 days. So referred to as 3 days measles. The rash is itchy, not as bright as that of the measles spots. The rash disappears with no staining or peeling of the skin. When rash clears up, skin might shed in very small flakes. These are called for shimmer spots, occur in 20% of the cases as by small red papules on the soft palate. Here one can see the spots on the body, on the rest of the body, and these are the for shimmer sign seen on the palate, and these are again the spots which are seen here in the case of rubella as the for shimmer spots. So the symptoms of the rubella are sneezing, runny nose, red eyes, headache, red rash, cough, mild fever, and the muscle pain. These are all the symptoms of rubella. And again here, respiratory tract symptom, cough and sore throat. Then there is the rash on the body. Lymph nodes are involved and that causes the lymphadenopathy. And when the joints are involved, there is mild arthralgia and the arthritis. And when placentitis occurs, placenta of the fetus is involved, that causes the fetal damage and placentitis, and ultimately the congenital rubella syndrome.